Good evening, everyone. Today we have Mr. N. Jayapandian with us. And Jayapandian has over 16 years of statistical programming experience in different roles and capacities. He's currently associated with Bayer Pharma as group leader, statistical programming, and site lead for data sciences and analytics. His past experiences are with Novartis, GSK, Target, and Standard Chartered Bank, with various domains of credit card analytics, retail analytics, epidemiology, and clinical trials. He played various roles technically, functionally, and at leadership level in statistical programming. He is also a Six Sigma Green Belt certified individual. He's leading pharmaceutical use India single day. They're called SDE events in Asian Pacific regions, with 4 events every year, and he's been doing that for the past 6 to 7 years every year. He's very passionate, and he focuses on developing people through strength-based approach. He keeps the team as a role model with the balance of opportunity, motivation, career growth, and recognition by aligning with business needs. So over to you, sir.
Say good evening, everyone. Definitely, you guys are going to be the key driving force for the for changing this world, India, and by thinking out of the box. And so you guys are at the right platform. SIBM definitely it will give you a great opportunity. And I wish you all the best as you guys are the first year students. I wish you all the best for your career and the future. I think the topic you guys have chosen is really an amazing. It's key, one of the key topic for a discussion today. And how do we leverage the blockchain with the discovery of a COVID-19 vaccine. So thank you so much. And I think I'll just skip my introduction, because Srinivas has done my introduction. A quick disclaimer. So the contents, the views, opinions expressed in these presentations, it's on my views. It's not necessary to be Bayer, and so it's all my views. And apart from that, there are some pictures I have taken, some of the contents I have taken directly from the internet, and I have just used it. But I did not mention the reference. But I just prepared the slide yesterday, so I did not mention. But I would like to highlight that I have used internet as one of the source for preparing a slide. Okay, so my agenda is going to be 3 key points and a quick introduction about, so because the topic covers blockchain and vaccine, so I'm going to give an introduction to vaccine, because I'm not sure how many of you are from the pharma background, or maybe I thought to give a quick intro on the vaccine development process. Also a quick intro about blockchain. And again, a disclaimer, I'm also a learner on the blockchain, and I just started learning in the last 6 or 7 months before, and I'm also new like you, but definitely I'll try to cover some of the basic. And then the other point is, how do we connect this blockchain versus vaccine in the vaccine development. Okay. All right. So for any drug development, yeah, it could be on any of the drug, like either cardiovascular or cancer drug or respiratory drug, or for this kind of vaccine development. And it has to go through a rigorous process. And there are health authorities, and definitely FDA in US plays a major role in approving the drug across the world. Then the next market is in the Europe market, then China market, then the rest of the world market, China, Japan, then the rest of the world market. So it has to go through a certain strict process. And for example, the drug development, normally it takes to bring one drug into the market, it takes around 12 to 15 years, and it hit more than €1 billion or dollar amount of money needed to bring one drug into the market. So of vaccine development, the picture which I am showing, it's mainly for the vaccine, this COVID vaccine, and the current stages there are around 138. This data as of August 13, which I have taken it, around 138 clinical trials on the vaccine development, on the preclinical, and the phase 1 on 16, then phase 1 to there are 19 trials, phase 2 there are 4, then phase 3, 7, and we are still waiting for the final vaccine development. About which all the key companies, on the trace of bringing that, almost they are about to launch the drug. They are almost at the final stage. If you look at India, definitely India is definitely competing with the global market, and companies like right, Serum Institute of India, Bharat Biotech, Zydus, Cadila, and Biological leads. So these are some of the Indian pharma companies are on top. Then if you look at US market, definitely Johnson & Johnson, AstraZeneca, Pfizer. Pfizer is almost there releasing the drug into the market because they focus some of the RNA related stuffs, and they're almost there. And definitely as a developed country, they try to use the vaccine first in the American people, right? And similarly, the European countries and companies like Sanofi, GSK are Europe-based head of these companies. Definitely, that they are also working on. And let's come to the concept of what is blockchain. Yeah, and definitely this is one of the keyword in almost every industry, and the technology led on people's mind. A lot of talk on the information technology. So what is blockchain, and how is the career opportunity in blockchain, and is the trending technology, which all industries are applicable, which we can apply the blockchain, is the software, how important it is, so how it works. So there are a lot of questions related to there, and this is what blockchain is one of the topmost word has been searched on the internet. Okay, um, uh, I'll just keep a few bullet points, and before I talk on certain things, basically like blockchain, it's a technology that helps in moving digital assets from one individual to the other individual. So here the digital assets on any of the it could be like transactions or a ledger, but in the digital asset form. We saw right how the execution of the transaction has been captured. That was through the centralized process. So what happened is there are a lot of things. You might have heard about hacking the system. There are a lot of transactions has been entered, misuse. A lot of things happened in the past, and so what the solution was, the next after centralized process, there was a solution was proposed like distributed system. Yeah, what does that meaning distributed? Basically, you will instead of having one server, basically there will be 3 to 5 servers, but each server will have the same information. For example, let's say I'm just transferring I'm just doing one transaction. That entire transaction will be captured in all 5 systems, yeah, or all 3 to 5 systems, and each and every system will have, if there are 1,000 records, then system server B will be having 1,000 records, server C, every server will have all the transactions. Yeah, and we assume that even if one system is hacked and you have the information from, and somebody is trying to edit and change it, you might need to change all the 5 servers. Yeah, and there's a different secure way of doing it. Okay, so that was one of the way it has been done in the distributed system, and later this is how the blockchain has implemented. So blockchain is basically trying to ensure it's a decentralized process. What do you mean by decentralized process? Assume that we are 10 customers, and instead of our transactions are stored in this kind of distributed system, each customer will act as a server. Yeah, if there are 10 customers, and 10 customers will be a server. Yeah, and each one will have everyone's transaction, but in a very safer way, which using crypto concept, right? And but each one will act as a server, and that's the reason, like, if the system has the one system which has been never hacked is basically this anything which is using the decentralized one, which is a blockchain technology. We saw what is blockchain, what is the vaccine development. So let's see now how blockchain in the vaccine development. Yeah, so where is the problem? Yeah, and where are the opportunities? Where is the problem in, especially in the been ready. Yeah, the vaccine has been ready, and it has to come to us, like people like you and me. We need to get vaccinated, right? And normally, what happens in the traditional marketing? Definitely, you might be aware, and you might have studied that it goes to manufacturing, then it goes to the stockist process, then distributor, and wholesaler, dealer, then it comes to the customer, and this entire process is supply chain. Imagine like situation of like pandemic and going through these many process, the time and the cost it takes. By the time it reaches to the customer, the cost of the particular vaccine it may be huge, and so there is an opportunity in the supply chain, especially on the vaccine development. And another thing is in terms of traceability. Yeah, how do we trace, especially during the supply chain? So the traceability is not only during the supply chain, and you might be also seen that a launch of Arogya Setu app, where we all have to enter it and assume that one person is having impacted by COVID, and people who surrounding him, how many of them have really impacted? How do we trace it? How do we look at that? Right. So traceability is one of the place where this blockchain has an opportunity. Yeah, there's a problem and there's an opportunity as well. Yeah, and definitely a country like in India, and all the record, the immunization record or wherever the clinical record is always on the paper based, and we never had any electronic record. And most of the places in India are like in villages, right? And maybe some cities they have just started on the electronic record, but most of us most of the portion is from the villages were still paper based. And how do we ensure that each and everyone across the world get that the vaccine, and how do we trace it? What kind of once the vaccine is done, are there any side effects? How do we ensure that there are different side effects? All those things we need to look at it. So basically we need to have a electronic records of the vaccines or the clinical stuffs. Okay. And definitely you might be seeing there are lots and lots of fake news. There are lots and lots of news going around the social media, various social media, and people just forward it without even validating it. How do we ensure we have the trust information? Yeah, and which is the correct information? Is there an opportunity? Definitely there's an opportunity on the here. And definitely there is always, right, there is a lot of donations has been going around across world. Many places, each country wise, WHO is collecting it, and state wise, central wise, many things happening. How do we track it? Are these funds are used in a right way, or how it's going on? Yeah, and definitely this is one of the crisis management, right? Crisis management. How do we, especially with pandemic COVID situation, how are we managing the situations? Yeah. And one of the key thing is because we are this the moment it talks about drug medicines, and these are patients, right? We'll be acting as each and everyone will become a patient, and the patient data is very, very important. It has to be kept confidential. That's it from my side. Thank you so much for the opportunity. So stay home, stay safe, and definitely there are a lot of things to explore it for sure. And stay inspired, open to questions.
Like my question is on we using Arogya Setu app, and we are also collecting data. So you mentioned that we're collecting data. So sir, I would just want to ask, like there is no like how will we verify as to the data is correct? Because even in the Arogya Setu app, we have to give the input, and so it's a challenge for researchers, I would say, that they can't verify if it's correct or not. They can't really rely on the kind of data that we are getting. What would be your views on that?
No, so the thing is that see, it's quite complex to understand because the moment it blockchain, right, each and every transaction basically, I mean, the one of the key thing of blockchain, that the principle, I would say, principle is the moment the see, for each and every transaction, basically it becomes a block. That block which contains about the who is sending it with the timestamp, And basically how the record is been captured is basically a combination of a different parameter around that, and that will be captured. And when there is a next transaction or this one, basically that goes as a block. And when there is a next transaction, that it also has the current block with the date and other information from the previous block. Basically it contains about a chain of the blocks, right? Here the one of the advantage of blockchain, what it says is, the moment the block is created, you can never ever edit by anybody, including the person who is creating it, because you never know how that block has been created. So that's what, you cannot change anything. You cannot, once it is created, the block is created, you cannot change anything. So that's what the blockchain is algorithm is talking about. So obviously, like the moment it traced it, and it automatically when converted into block, you cannot change it, and we have it's going to be more of a trustable data. That's the background setting.
So basically, it will consist the history of the
exactly
data.
It connects. Yes.
Okay. Thank you so much, sir.
Yeah.
So my name is Sagrika. I'm a second year student. So my question is regarding the legality part of all these vaccines. So so once it is developed, so how much time would it take to like properly launch? Like it's taking the consideration the legality part of it.
Yeah. So normal process, right? It takes 1 to 2 years. The moment any of the pharma companies, they prove that it is safety and efficacy is fine, and then the moment they submit the data to the health authorities, they take actually 1 to 2 years. Okay. But situations like the pandemic situation, they are trying to do it less than a month. Yeah. And they are prioritizing every health authorities in like FDA or Europe, and they are prioritizing any vaccine comes. This especially COVID vaccine comes into that. So they are trying to. This comes under the accelerate drug development. Yeah. So it could be less than a month.
Thank you, sir.
Thank you so much for accepting our invitation. I think the students need somebody like you, dynamic, young, and happening manager. So I
Thank
think
you so
all the
much.
students can learn a lot. Thank you so much for coming on line, Jayapandian.
Thank you so much, sir.